Today I am going to discuss on thyroid problem in dog. I think everybody knows of thyroid. Thyroid is a gland located in dog's neck as butterfly near the trachea, which produces a hormone known as thyroxine. This thyroxine helps in the regulation of body temperature of dog as well as in human being also, and metabolism. These two important functions are being done by the thyroxine, and it is a great problem in human being also. Now question comes, thyroid, normal thyroid gland level, and sometimes it goes down. We call it hypothyroidism. Hypothyroidism means thyroid is not producing enough thyroid hormone to support the various functions of the body, and it is mostly seen in young dog metabolism. It has got impact to nearly every cell in the body. It is very important that every cell of the body is being regulated by thyroxine. And when I say about metabolism, metabolism denotes the process of turning food into fuel. That means whatever food or nutrition or nutrients we are consuming, that is turning into energy. So whatever energy we are getting, thyroid plays an important role in it. So as a process, metabolism means there are two things. One is anabolism, means increment of body weight, increment of energy, everything, and catabolism means destruction. So if the thyroid level is not maintained, so in that case, destructions of the cells will be continuous, and that man or that animal will not get any energy to work. Now the question comes, why this happens? Normally nature has given the gland has to function. But sometimes we find that the gland is not functioning well, and there is not enough thyroxine to safeguard the life of the animal. So what are the causes? Why it is happening? That is a very important question. So it has been seen that environment itself is a great problem. Why? Because there is fluctuation of the environment. Sometimes humidity, sometimes non-humidity, sometimes dry, sometimes cold, sometimes hot. So this environment, they have got certain influence on the thyroid glands, and it goes shrinkage. Then consumption of highly processed, poor quality commercial dog food. Nowadays it has become a fashion because nobody wants to cook for the animals, so they go for the ready-made food. Now the question is that if the ready-made food is certified or proven, there is no problem. But sometimes the local people, they also start producing the processed food, and in that case the ingredients may not be suitable for the animal itself, at the same time on thyroid gland. So quality of commercial dog food is also one very important point. And most important causes are the disease itself, involvement of the thyroid gland. What is that? One is lymphocytic thyroiditis, that is the inflammation of the thyroid gland. And second is idiopathic thyroid gland, means we do not know why it is happening. Idiopathic means unknown etiology. Etiology is not yet determined. These are the two important points. Besides that, there may be inflammation or shrinkage of the thyroid gland for various reasons. Then if you go for the clinical signs, so the animal will show excessive fatigue, that means tiredness. If the dog which was very much active, it has become very tired, not dull and not fatigue, that means very much tiredness. Then if you look at the eye, there is bulging of the eyes. It is very common in children or human beings, bulging eyes. Then mental aberration, mental dullness, because intellectuality, that also being governed by the thyroid gland. So already I have told there is tiredness, there is depression. Sometimes the weight may be increased, obesity. By looking at the animal, we can say that the dog is obese, therefore it is likely to suffer from thyroid gland problem. Then change in voice, that is also very important. Change in voice of the dog. Then cold intolerance, heat seeking. That means you will find that where there is hot, animal wants to go there. Even it wants to go to the roof of the house. Why? Because it gets some hot. Because hot is very favorable for the physiological functioning of the animal. Therefore, animal, they know that if I go to the warm places, hot places, I will get some relief. So we call heat seeking. Heat seeking, but wherever there is heat, you will go there. Skin infection is very popular. And here I tell you, in case of alopecia or skin problem, they will be bilateral. Both the sides will be affected. But in infection, what happens? One side may be affected. Here, both the sides, symmetrical alopecia or loss of hair. So, skin infection or skin alopecia will be bilateral, symmetrical, same time, both the, because it is from central. Therefore, both the sides will be affected. But in case of infection, the site which is being affected by the bacteria, that side will be show the lesion. Skin and coat changes already I have told. Excess smelling, shedding. Sometimes the owners come, they say, you see, my dog is smelling too much, and there is shedding of hair. So that may be one of the cause may be, there may be other causes also, but one of the causes is hypothyroidism. Then skin and coat changes, color may be changed here. Excess shedding, then excess dandruff. Dandruff means pityriasis. In Bengali we call khushki. That is also brand-like deposition throughout the body of the dog. Then dull and dry coat. Sometimes ear infection. And if you look at the ear, you will find red, painful, at the same time smelly. And if you look at the abdomen, flank region, you will find that there is black patches. We call hyperpigmentation. Pigmentation may be hypopigmentation, may be hyperpigmentation. Here, deep color. So, a white colored abdomen, sometimes from the flank region, may be deep colored or hyperpigmentation. And heat cycle will be more. We call prolonged heat cycle. Then generalized weakness. When the animal is walking, the stiff walk, unable to walk comfortably, we call stiff walk. Then loud breathing due to laryngeal paralysis. Then sometimes there may be nervous problem or neurological problems. Amnesia. Sometimes there is hair loss of the tail. It is very important. If you look at an animal having fur throughout the body, and if you look at the tail has become very no hair in the tail. We call rat tail. Just like rat, the tail has appeared. So by looking these signs, sometimes we can suspect as a physician that the animal might be suffering from hypothyroidism. Accordingly, we will have to go for treatment. So rat tail is very, very important clinical signs or clinical attributes. If you want to diagnose such cases, then one has to go for level of cholesterol. Cholesterol has got a bearing on thyroxine level. Hypercholesteremia means that the cholesterol level has gone up above 200 milligram. In that cases, there may be thyroid problem. Then level of amino acid may go down. Iodine, probiotic, gut health, antioxidant, these all get lowered. But we generally do not go for those tests, but we go for the test like TSH, very important. Thyroxine or thyroid stimulating hormone, TSH. and then the level will be high. If it goes beyond 4, above 4, then we say that it's hypo. And if you can go for T3, T4, TSH, all components or thyroid profiles, you can judge those. So, by looking at the TSH level, it is possible to arrive at a diagnosis that the dog might be suffering from hypothyroidism or thyroxine level is poor or low in quantity. Then if you want to treat such cases, what you will do? So the question is that there is no thyroxine, so we'll go for thyroxine preparation. So levothyroxine preparation based on thyroid level, right? Various level is available starting from 25 milligram, 37.5 milligram, 50 milligram, and so on. So according to the level, we adjust and introduce the thyroxine tablet or thyroxine medicine. So this preparation has to be given if there is thyroid problem. And one thing I tell you, many a time, many owners ask us that, sir, thyroid is not a problem in dog, it is a problem of the human being. But one thing I tell you, whatever it is a problem in human being, no doubt about it. But one thing, if you make the sex differentiation, it is more in female rather than the male. Our second point is that if this level is controlled or you come to a baseline level and it has to be continued, you cannot leave it all of a sudden. This is a problem. Just like blood pressure, you have to continue the medicine. So likewise, thyroid preparations, if you want to, or if you take orally, in that case, you may have to go on treatment, go on giving that thyroxine preparation for a long period of time. It is not like that you give for 3 days or 5 days and then discontinue. It will not be like that. And we can give some supplementation also. This supplementation may contain iodine. That's why you know iodized salt is available in the market. Iodine, selenium, zinc, these preparations may be given. And the zinc preparation, iodine preparation, that are also available. And if you go for the foods, then green beans, beets, broccoli, cabbage, carrot, spinach, and mushroom, you can feed to your dog in little quantity so that the level may be maintained. So we go for medicine, we go for supplement, we go for food. These 3 things are important. One thing I tell you, sometimes the thyroid level goes down. Why? Suppose one is suffering from epilepsy. So anti-epileptic drug, if you consume or if a dog consume anti-epileptic drug for a prolonged period of time, in that cases, there may be depression. Level may go down. Then prednisolone. Generally, prednisolone is applied in many cases. So prolonged use of prednisolone is also not good for thyroid patient. Then high heart medicine, propanolol, that is also important. Sulfur drugs. And sometimes, altered behavior. So we want to change the behavior. So we call behavior attention drug. So if you should not give this drug for a long period of time. If you give so, in that case, the questions of hypothyroidism may arise. Then this is hypothyroidism. This is important. But there is another condition, hypo and hyper. So there may be hyperthyroidism also. It's a relatively rare condition in dogs. And human being also is a very rare condition. Sometimes we call thyrotoxicosis. But if it occurs, it leads to a serious health problem. When thyroid gland produces excess amount of this hormone, it may be due to, it may cause, even I tell you, swelling under neck, we call goiter, and sometimes there may be carcinomas. Increased appetite, weight loss. There I was telling about the weight gain here, I'm telling that weight loss. Hyperexcitability, just alternate. Gagging and vomiting. Rapid heart rate. Increased urination. Enlarged heart. Enlarged thyroid gland, already I have told you. Then there will be diarrhea also. Congestive heart failure. That's why doctor used to say that when a patient or a dog is suffering from congestive cardiac failure, in that case, you must measure the level of thyroid. Thyroxine level has to be measured because it has got a correlation with the functioning of the heart. Then difficulty in swallowing because there is mass. In that case, the esophageal tube is narrowed, and therefore difficult to swallow. Even a tablet cannot be swallowed. Then change in bark and facial swelling, shortness of breath, and here also there may be bulging of eyes. Diagnosis if you want to do in case of hyperthyroidism, in that case only if you peck the area, you will find there is some mass in the neck. In case of human being, we say goiter and increased heart rate, and if you go for blood, thyroid hormone level will be there. I was telling decreased, here it is increased. Treatment, I tell you, there is no treatment, no attributable treatment or satisfactory treatment for hyperthyroidism. But one thing I tell you, that nature has given the permission that, or somehow or other, this problem is very, very less. Hyperthyroidism is very, very less. When we say about the thyroid problem, immediately we go for hypothyroidism. We never think that there may be hyperthyroidism also. But it is very, very less. That is good for us. And treatment, if you want to go for treatment, to surgery, you have to remove the mass. Remove the thyroid mass or tumor. And second thing is radiation therapy. And so far the other aspect is concerned, we can think that we should avoid foods, as I have mentioned now. Those foods should be avoided as far as possible. Nutrients, we have to take care of the nutrients, and chemicals to be avoided. Iodine increases thyroxine level. Here we do not want to increase further. Calcium and vitamin D, it affects bone and mineral density. Food containing caffeine increases the TH level. So this thing has to be taken into consideration. Sometimes low iodine content food and nutrient, non-iodized salt, egg white, doesn't contain any iodine. Frozen vegetables, herbs and spices, vegetable oil, sugar, honey, jam, jelly, unsalted nuts, moderate meats, beef, lamb, chicken, mutton, fruit and fruit juices, that to be these are to be taken into consideration. In a nutshell, there are two problems. One is hypothyroidism, other is hyperthyroidism. One is less, one is more. In hypothyroidism, thyroxine level is being maintained. And what is the function of thyroxine? Thyroxine convert the metabolism, convert the food into fuel. That means food to energy. But here, in case of hyperthyroidism, you don't get any energy. This is the difference between the two. And therefore, we will have to go for clinical science, clinical attributes. Then we will have to go to laboratory to measure the thyroxine level, of which TSH is very important component. And then we will have to avoid certain chemicals or foods or drugs, right? And or on the contrary, we may have to supplement certain chemicals, that is iodine, zinc, selenium, or fruits. Right? So in that way, we can manage the conditions.
যদি আপনাদের আমাদের এই চ্যানেলটি ভালো লাগে তাহলে সাবস্ক্রাইব করুন এবং শেয়ার করুন।